Welcome back to session 12, where we will focus on acceptance and commitment therapy. This is one of my favorite modalities, and it will help with many different issues, mental health issues, and can be a very valuable therapeutic approach. So starting with a review of the third wave of CBT, basically the third wave of CBT focuses on acceptance. So different approaches such as acceptance and commitment therapy, dialectical behavior therapy, mindfulness-based therapy, and mindfulness-based stress reduction, all those can be helpful. So mindfulness-based cognitive therapy or stress reduction are all based on acceptance, versus the first wave of the CBT in the 50s and 60s, which focused on behavioral therapy, and the second wave focused on cognitive behavioral therapy. This one is primarily focused on acceptance. Its ACT is created by Steve Hayes. It was created in 1986. It's proven effective with depression, obsessive compulsive disorder, stress, chronic pain, stress of having a terminal illness, anxiety disorders, post-traumatic stress disorders, anorexia, substance use, and even evidence-based for schizophrenia. 4 hours of acceptance and commitment therapy reduced hospitalization and readmission rates for individuals with schizophrenia by 50% over the next 6 months. It's excellent data showing efficacy even with psychosis. ACT is an existential and humanistic cognitive behavior therapy approach with a lot of mindfulness techniques and behavioral therapy included in it. So basically, Western psychology defines healthy normality and suffering as abnormal. And ACT challenges these Western ideas and moves us to focus on acceptance rather than symptom reduction. So the emphasis is on clarifying values, the client's values, what's important to them, focusing on forgiveness, acceptance, compassion towards self and others, and living in the present moment mindfully. So the goal is to create a rich and meaningful life, and at the same time accepting the pain that inevitably comes with life. There is no manual. It's not a manualized approach such as DBT has a manual, mindfulness-based cognitive therapy, and has a manual, but ACT does not. It's an approach that's used with individuals, couples, in groups, in short-term and long-term therapy. So the ACT goal is to undermine the client's agenda of emotional control. We try to control things, and by doing so, we create problems. We undermine the client's agenda of emotional control by first beginning with asking the client to identify ways they try to get rid of symptoms. Well, I tried to get rid of my panic attack symptoms by not going outside. I tried to manage my stress by drinking. I tried to manage my symptoms by isolating. So we try to, whatever they've done to try to get rid of the symptoms basically does not work. And our goal is to help the client see this for themselves rather than telling them that it doesn't work. We're having them identify what they've tried to do to get rid of symptoms. Their unhelpful thoughts or self-deprecating thoughts or anxiety, anxious thoughts. And then we ask for each method that they've tried. Did it reduce your symptoms in the long term? Did it cost them? Did it have a negative cost? For example, I tried to avoid getting a panic attack, so I avoid going out. So the cost to them is impact on the relationships, not having opportunities to build relationships or maintain relationships, or impacted their health. I tried to numb my feelings by drinking, so it impacted my health. Did it bring them closer to what they want, to their values and their wants and their goals? And we may assign homework related to this, to notice and write down ways that they try to emotionally control their symptoms. What have they, to basically notice emotional control strategies and assessing their effectiveness. These emotional control strategies, do they help with long-term benefit? Do they help them have a good quality of life? So our goal is to increase the client awareness that emotional control strategies are largely responsible for their problems and actually create problems for them. So we may use different techniques, like metaphors. For example, it seems like the more you fight, the more symptoms you have, as if you're trapped in quicksand, or it's a vicious cycle of suffering, or it's like having an emotional amplifier. The more we focus on controlling anxiety, the more amplified the anxiety is. So we may describe something called the struggle switch. And I believe I posted a video for you about the struggle switch that you may watch with a client, or assign a client to watch in between sessions. So when we see the anxiety or anxious feelings as unacceptable, we have more pain, we feel more angry, we feel more anxious. The more we struggle with the anxiety, the more we fight it, the more we struggle. Same with pain. The more we fight the pain, preoccupied with thoughts about the pain coming, or anticipating the pain, or the aftermath after we experience a painful experience, the more we struggle, and the more we have problems. So another concept that's used is clean discomfort versus dirty discomfort. The more you fight feelings, the more you're overwhelmed. The more you struggle, the faster the quicksand sucks you under, versus clean discomfort, where you see discomfort as natural, versus turning the struggle switch on. For example, having someone with ongoing medical issues like arthritis or lupus, pain is going to be part of life. If you look at pain as a struggle, rather than looking at pain as part of this. I'm having arthritic pain. Oh, that's part of having arthritis, versus this is horrible pain. I don't want it. I'm fighting it, can be more problematic, creating a vicious cycle of discomfort and what's referred to as dirty discomfort. This doesn't mean that the individual is not going to address pain, or it doesn't mean that they're not going to address anxiety, but it's going to start with acceptance rather than struggle. So the basic principles of ACT is that attempts to get rid of symptoms actually creates clinical disorders. The goal is to transform our relationship with our difficult thoughts and feelings, so we no longer perceive them as symptoms. So to be able to recognize and work on acceptance rather than perceiving them as unwanted. Oh, it's normal for me to be anxious in a social situation, versus no, I shouldn't have anxiety about social situations, therefore I should avoid. And when I avoid and I continue avoiding, then I develop agoraphobia. So the goal is to transform our relationship with these thoughts, these anxious thoughts and feelings, so that we don't perceive them as threats. Same with psychosis, because I mentioned that acceptance and commitment therapy is helpful for schizophrenia and psychosis. And so if I'm having voices and I'm saying, I don't want these voices, I hate these voices, the more I fight these voices, the more stressed I am, which causes more voices. But the idea is to say, oh, I'm having voices. It's part of my experience. When I experience more stress, I experience more symptoms. Maybe this is my body telling me that I need to reduce my stress. And so you're changing your relationship to your thoughts and feelings, with your thoughts and feelings. So perception of symptoms changes to uncomfortable and transient psychological events. My voices will go away. My anxiety, my panic attack will go away. It's usually short term, it's going to go away, rather than being enveloped by all these difficult emotions. Symptom reduction is not the goal, but it's a byproduct of acceptance and commitment therapy. So our goal is to not reduce symptoms, but symptoms naturally reduce as we do and work with acceptance and commitment therapy concepts. %30 of adults will have a psychiatric disorder in a 1-year period, and that may be an underestimation. NAMI may give you figures that are larger than that. 1 in 2 will consider suicides seriously at some point in their life. And ACT assumes that psychological processes of normal human beings are often destructive and creates suffering. And what ACT, one of the main principles of ACT is that the root of suffering is in the human language, our thoughts. That's the root of our suffering. We may not be aware of this, but it is the root of our suffering according to ACT. So experiential avoidance is basically where we avoid. It's how we cope is by avoiding. It doesn't necessarily mean that it's healthy coping, but emotional control strategies where we attempt to control feelings is basically avoidance. So an example is drinking after work to avoid the stress of the day. Or again, avoiding social situations because you're afraid you might be judged, or afraid of going out due to fear of panic attacks. All those are experiential avoidance techniques that we engage in. So emotional control strategies are associated with anxiety. The more we perceive our thoughts, experience, symptoms as problematic, the more anxious we get. So it's these control strategies are associated with being anxious, depressed, with substance use, with poor school performance, and low quality of life. I'm afraid I may not do a great job. I want to do a perfect job. Therefore, I'm not going to, they procrastinate and they don't do the work. So the anxiety, performance anxiety, may lead to poor performance in this case. So we attempt to control our feelings to feel good or to avoid feeling badly. But in ACT, we learn to reduce the impact and the influence of these unwanted, unhealthy, anxious thoughts and feelings through mindfulness. The more we're mindful, the less anxious we get, the less preoccupied we are with these thoughts and with these emotional control strategies. You cannot be anxious and mindful at the same time. If you're truly mindfully present, non-judgmentally, mindfully present, you cannot be anxious, because anxiety is tied into judgment about what's happening, preoccupation with the future, preoccupation with the past. But if we're mindfully present, we're going to feel much better, less anxious. So the idea is not to fight, but to be open to feelings and allow these feelings to come and go without struggle. Oh, I'm having an anxious thought, naming it and not judging it, not fighting it, but being mindfully aware as if it's a passenger on a bus. I believe I posted another YouTube video you could watch with a client, passengers on the bus, where you visualize passengers on the bus being thoughts that come and go, thoughts that come through and pass through your mind, observing them non-judgmentally, allowing them to pass, like a stream on a leaf. passing by without judgment, without tension, without fighting those feelings. So taking effective action, guided by our values to change life for the better, is one of the principles. So for example, if I know I value relationships, so I'm going to take action toward that value, regardless of the anxiety that I feel. And this I will explain a little bit more. But the gist of it is that if I am clear about my values, I may be more committed to action that's difficult because I'm guided by my values. If I value relationships, I'm going to push through that anxiety and identify it non-judgmentally, accept it, and then continue with the action of going to social places and interacting with others. So I'm guided by my values to motivate me to take the steps that I need to take to have a good quality of life. So basically, the two processes in acceptance and commitment therapy is to develop acceptance of unwanted private experiences, whether that's the thoughts, the emotions, the feelings, the pain, and commitment and action toward living a valued life. So I accept what's happening, yet I'm committed to take action toward a good, having a valued, good quality of life. What is psychological flexibility? So in acceptance and commitment therapy, being psychologically flexible involves having contact with the present moment fully, being fully mindful of the present moment as a conscious, historical human being, and based on what the situation affords, changing or persisting in behavior in service of chosen values. Okay, that sounds like psychobabble. So let me just see if I can translate that for you. So being mindfully present, conscious, seeing yourself as part of this universe, using a spiritual perspective. I am here as a historical human being for a purpose, and I'm part of this purpose for having this valued life. And based on the situation in front of me and the things that I'm experiencing, I am clear about my values, yet I persist in the behavior that I need to, and the action that I need to engage in service of these values. So I'm mindfully present of my thoughts, conscious of my situation, non-judgmentally perceive all these actions, and I value relationships. Therefore, I'm going to engage in this behavior by interacting with individuals in a social situation, regardless of my social anxiety. So if you did not have pain, what would you do with your life is a question that you could ask a client. Or if you did not have this social anxiety, what would you be doing with your life? If you did not have these voices, what would you be doing with your life? This helps the client understand their values and help the client find the action and the goals that they want to engage in to have a valued life. Psychological flexibility includes acceptance. Diffusion is where you separate your thoughts from yourself. You look at thoughts basically, not from them. So I'm having a thought that I'm feeling worthless. It separates you from I feel worthless is a thought that you're having, but I'm experiencing a thought, or I'm having a thought that I'm having feelings of worthlessness, gives you that separation. I'm having a thought, that awareness, that separation is basically diffusion. So, and establishing a transcendent sense of self has to do with really, this is the spiritual part that I referred to earlier. where you expand your personal boundaries. You experience yourself as looking at this from a spiritual perspective. You are an integral, an important part of this universe. You are part of this universe. And separating yourself, instead of looking at yourself within those thoughts and having those thoughts dictate who you are, you're from a spiritual perspective, seeing yourself as part of this universe. And contact with the present moment helps you reduce the dominance of your thoughts. And this dominance of the past, thoughts about the past, or fears about the future, is addressed by contact with the present moment, by being mindful. And the values are basically your chosen life direction versus not having clarity about what your values are. And with this, you build a larger and larger pattern of committed action linked to those values, even if you're experiencing anxiety, voices, obstacles. There's a graph that will make this a little bit more clear, if you can stay a little bit patient with me. So one of the first books I read after grad school is Jon Kabat-Zinn's books on mindfulness. There's actually many books written by him on mindfulness and by many other authors. After grad school, I made a commitment to every other book that I read needed to be non-fictional, related to my work in the field. And that was extremely helpful because your learning is not going to end here. But this is a book that I would recommend, or any other books on mindfulness. But according to Jon Kabat-Zinn, mindfulness is much easier learned by experience. So you can't really cognitively learn it. It's a practice that you need to practice daily. So I may work with a client on a mindfulness technique, but it really is not going to be helpful unless it's experienced with practice daily. So you may explore the option of doing a 5-minute mindfulness exercise so that when it's needed, you can tap into it because you've practiced it all this time. So it's helpful to practice it and experience it more frequently by paying attention. So it's basically paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. So it could be a simple act of you doing the dishes, paying attention, feeling the soap on your hands, feeling the warmth of the water on your hands, noticing the dishes, and on purpose, being mindfully present in each moment, non-judgmentally. Oh, judgmentally would be, oh, I have to do these dishes. That's a judgment. Noticing thoughts, allowing them to pass as if they're passengers on a bus, or the concept of Teflon mind, like Teflon doesn't stick. Imagining the thought as if your mind, as if it's Teflon, the thought passes through and slides out. Remaining mindfully present with the exercise of enjoying, paying attention to the dishes, noticing the temperature, noticing the texture of the dishes, the warmth of the water as you do this. That's one simple mindfulness exercise you could do. And so what mindfulness does is that it undermines the dominance of the verbal networks. This is important to remember. So the dominance of the verbal networks is basically the dominance of our thought process. We are preoccupied with thoughts all the time. Did I say this right? Did I hurt her feelings? Did I do this right? Did I come across knowledgeable? Did I do this? Did I fail here? Did the client think I was doing a good job? All those thoughts go through our minds all day. We're just not aware of this dominance of thought processes that undermines mindfulness and impacts our quality of life. So mindfulness helps address that and undermines that process. So doing one activity exclusively, committed to the present moment, and catching yourself every 4 to 5 seconds if you find yourself judging, preoccupied with other thoughts, jumping to the future, jumping to the past, jumping even to thoughts about the present, is to catch yourself and move on. And again, not judge the thought, but let it slide out as if it's your mind is a Teflon mind, or as if it's a passenger on the bus. There's many endless exercises that you could do with mindfulness. These are just examples. So we talked about thought diffusion. Diffusion is where you separate yourself from the thoughts, versus fusion. So you're looking at thoughts, not from thoughts. Language events don't have to influence you. The thoughts don't have to influence you. Mindfully noticing thoughts go by you as if they are leaves moving through the stream. I'd like to do this exercise with you. If you could close your eyes for a moment as I go through this one slide. And close your eyes if you can. Take a deep breath in through your nose and out through your mouth as I do this exercise with you. And if you can, breathe in to the count of 6 through your nose and hold for 2 and breathe out to the count of 8 through your mouth. Breathe in through your nose to the count of 6. Pause for 2 and breathe out through your mouth to the count of 8. Try to do this for the next minute as I do this exercise with you. Continue breathing. You are not your thoughts. You have them. You are not your feelings. You experience them. The core you is not your role. You do them. You are not your sensations. You feel them. You are not your labels. You experience them. You are not your body. You have one. The core you is not changed by your experience. You identify these things. It's not you. So take another breath as you end this exercise. So with diffusion, you're separating yourself from your thoughts, your feelings, your role. You are not a student. You play that role. You are not your sensations. You feel them. You are not pain. You feel pain. You're not a label. You hear yourself labeling. You just experience a label. Your body doesn't define you. You just have one. Experiences are not you. It's not you. You experience these experiences. So basically, I want to talk about psychological flexibility by first beginning to talk about the opposite, which is psychological rigidity. So when our thoughts are dominant, our thoughts about the present, or the past and the future are dominant, we may be experiencing avoidance. The thoughts, I'm anxious, therefore I'm going to avoid. I had a stressful day, I'm going to numb by drinking, by using Netflix for 6 hours in a row to avoid the stress. And so experiential avoidance is part of inflexibility, psychological inflexibility, and cognitive fusion, basically relating to thoughts as if they're the truth, attachment to the thoughts, and not separating ourselves from the thoughts. And absence of a clear, our absence of clarity about our values, or confusion about what our values are, and inactivity and avoidance are all part of psychological inflexibility. And again, these are not things to help us or to make us feel bad. We all experience this. We all do experiential avoidance. But the idea is to move towards psychological flexibility and not have it control our life or dominate our life. So the acceptance and commitment therapy Hexaflex is very, very helpful, where this graph can be very useful even in working with clients and showing this to them, where you are working with them on staying in the present moment rather than being dominated by the past or future. Acceptance of the current situation, acceptance of thoughts, feelings, emotions, rather than avoidance. And diffusion, separating ourselves from the thoughts, emotions, feelings, experiences, and seeing ourselves in context as spiritual beings in this world, rather than having a narrow view about our current situation. And having clarity about our values and a clear life direction that helps us commit to action based on those values. So that is what psychological flexibility is: being mindful, separating ourselves from our thoughts, seeing ourselves in context rather than ruled by roles that we play or experiences that we experience, and being clear about what our values are so that we can engage in action aligned with those values. So I might ask a client, given the distinction between you and the stuff that you're struggling with, anxiety or whatever it is, given the distinction between you and the stuff that you're struggling with and trying to change, are you willing to have that stuff fully and without defense as it is, and not as what it says it is? And are you willing to do what it takes, what takes you in the direction of your chosen values? So to bring this to life, given the anxiety that you experience, follow the numbers 1, 2, 3, 4, 5. Given the distinction between the stuff that you're between you and the stuff that you're struggling with, the anxiety, are you willing to have the anxiety fully and without defense, without fighting it, and separate your thoughts? Engage in cognitive diffusion and look at thoughts, not from thoughts. And are you willing to do what it takes for you are you willing to do what takes you in the direction of your values? Are you willing to go out so that you can have that relationship that you want? Are you willing to take the step regardless of the pain that you're experiencing? If health is important to you, are you willing to go and take a walk despite the pain because you value your health and you want to improve flexibility and mobility? And so basically, clarifying those values can help the individual take that committed action, no matter how difficult it is, and work on acceptance rather than fighting and turning that struggle switch on. This is another exercise that you can do with a client, identifying what's important and moving on, what internal stuff has been getting in the way, what internal stuff has been getting in the way of moving toward what's important to you, and what have you been doing so far to deal with this and move away from internal stuff that you don't want to have, and what behavior can you do to move you toward what's important to you while having the unwanted internal stuff. So the goal is to identify those values, not fight the struggle that they're experiencing, but to move toward acceptance and action that's aligned with their values. This is another worksheet that you can do, and acceptance and commitment therapy is one of those approaches that is so the individuals, Haynes and others that have done extensive work on this, are so generous with information that many of these tools are open access. In fact, if you look in the resource section, you'll see a lot of open access articles. Even if you're at your internship, if you go and Google acceptance and commitment worksheets, you will find many of them. They're extremely generous with wanting to pass this information, unlike other approaches that are copyrighted, heavily copyrighted, and you need to purchase. There's a lot of worksheets that you can find on that are open access. So this exercise is basically a commitment plan. So I am committed. So basically here, notice if you are being influenced by unhelpful self-description, letting go of anything unhelpful, being here now in the present, noticing what's happening and letting go of any distracting thoughts. So basically mindfully, mindful, present, accepting, acknowledging emotions and having them without having to control them, being willing to simply have those thoughts and feelings and emotions and moving forward with productive action, whatever that action is. Noticing, preparing to simply notice thoughts, because when you're mindful, thoughts are going to come. Noticing, but letting them go, not fighting them. And taking action toward the values that you have, things that you care about. So basically, there's many different worksheets. This is just one of them that takes you to help the client work on moving toward living a valued life by accepting, mindfully living, and thought diffusion, separating self from their experiences. I love this exercise because it helps me determine where the client wants to go with goals. And even if you don't use acceptance and commitment therapy, if you could utilize this with any approach to help you clarify client wants, desires, and goals. This batteries exercise, you can Google that, by the way, and there's a lot of open access ones to this as well. Basically, what you're doing is that in these boxes, you're rating how important these areas to you. For example, is having an intimate relationship important? Is it a 10? Family, maybe a 10. Maybe having friends is important, but maybe not as important. Maybe it's a 9. And spirituality is very important. Maybe it's going to be a 10. Or work and career is not important right now. Maybe it's a 2. These are just examples. Or maybe my health is really important, so it's a 10. So whatever the values are, it's going to help clarify the goals. What do you need to do? What kinds of action does the individual need to engage in to help them live a valued life, live a life that they want to live? Education is important. Therefore, I'm going to continue with the struggle that it takes to continue this graduate program. Or spirituality is very important. Therefore, I'm going to take the following steps, even though it's really difficult to fit in my schedule. Or my anxiety is so severe, but intimate relationships are important, so I'm going to push myself to go on this date, and accept the anxiety and go toward that valued life. My health is important, therefore it's going to be important to me to participate in the following things: engage in exercise, avoid alcohol, avoid using substances. So this exercise can be very, very helpful. So I'm going to review here the 6 core concepts of ACT. Cognitive diffusion. So rather than looking at thoughts as the truth, being able to step back and observe language as transient, sliding, moving through the stream, moving as a passenger on the bus, or as a Teflon mind sliding out. As we diffuse thoughts, they have less impact on us when we observe with detachment. So it helps us detach from the thought. So when you say, I'm having thoughts that I'm worthless, you're separating yourself from those self-deprecating thoughts. Or I'm anxious versus I'm having thoughts that I'm anxious. Acceptance allows us to come and go. Acceptance where you allow thoughts to come and go without struggling and without running away from the experience. So you're accepting. It doesn't mean you're agreeing or you're wanting, you're just basically accepting. And contact with the present moment is being mindful using the 5 senses. Observing self, distinction between thoughts and self. So you are separate from your thoughts. Values, willingness, allowing anxiety in order to do something of value. Okay, and I gave you some examples about that. And finally, the committed action, setting goals guided by our values to take effective action to achieve our goals, whatever that goal is. Improved health, spirituality, relationships, intimacy, school, academic, anything of value to the client. These are book recommendations. There's many others, but these are ones that I put on this slide. There's a lot by Stephen Hayes, ACT Made Simple by Russ Harris, Acceptance and Commitment Therapy, the Process and Practice of Mindfulness, Mindful Change by Haynes is another book. There's books by Thich Nhat Hanh on mindfulness. I love The Miracle of Mindfulness and Wherever You Go by Jon Kabat-Zinn. All of those are excellent. If you look on Amazon, there's tons of books, but again, acceptance and commitment therapy is one of the few modalities that provides you with a lot of open access articles that you could utilize. Please check out the resource section for additional resources on ACT. Okay, and this wraps up our session. Thank you, and have a great day.